We know that some people are feeling anxious. This video is about whether we're going to need a huge mental health program to help people cope with the impacts of coronavirus on individual lives and society, or whether something else might be needed instead. Although COVID-19 is a very different kind of crisis compared to those that many places in the world have faced recently, what we already know about what gets us through a crisis is super relevant and helpful here. We also need to think about what helps to determine or drive the level of mental health issues we have in modern societies outside of COVID-19 times. What does this tell us about what we need to do next? There's clearly a need for mental health services for many of those affected by COVID-19. Patients who have been through really rough experiences being ill with COVID-19, but also possible post-traumatic stress issues for those who, in very busy or trying circumstances, have been busy helping others. All this and more. But the evidence is that when people have good social support, most people get through okay without need for formal treatment. That's not to say that they won't feel anxious or sad, but it does mean that these are common responses that tend to be managed okay, so long as people have access to the social support they need and also getting their basic needs met. For some people, where they don't feel like they have the personal resources to cope effectively and they are struggling, then yes, there is certainly a place for mental health services and prescribed medication where this is appropriate. But rather than just treating the symptoms, maybe we should be looking at the causes too and doing something about those. And those causes have been around long before coronavirus times. So, social support and wider factors that have an effect on mental health. Let's look at these two factors in a bit more detail. First, let's talk about social support. We know that how connected we are with each other determines how we develop a shared sense of purpose and meaning as individuals, families, and communities. We know from the research that even simply knowing you can borrow $100 in a time of need, this helps to bolster the sense that we're not alone and strengthens our well-being. But one of the issues that has to be talked about here is loneliness. The absence of social support was a big factor in driving up the level of misery and despondency for many people who felt cut off from others and had no meaningful social engagement in their communities.
Just, my life isn't that interesting. I go to work, I come home.
And tragically, this has led to people dying in their houses during COVID-19 lockdowns, lying undiscovered for days and sometimes weeks before someone went in to check on them. Loneliness isn't just about isolation. It's a factor, but it's certainly not the only one. Feeling lonely is not the same as being alone.
It's kind of lonely in here, man.
Loneliness is a feeling of disconnection. It's the sense that no one around you really understands you and that you don't have any kind of meaningful connections you would like. You can feel lonely in a crowd just as you can feel perfectly happy, even relieved sometimes, to spend some time alone. So loneliness is a factor because it's that feeling of disconnection. And we know that a good level of social support and connection is a protective factor when going through a crisis. And there's a whole heap of work going on around how online communities can be both beneficial and also bring their own risks too. If you're interested, just have a listen to the Rabbit Hole podcast by the New York Times. I'll leave a link in the description, as well as a series of YouTube videos on loneliness and how to help to deal with this problem. What about people getting their basic needs met? These are called the determinants of well-being, and much of this contributes specifically to mental well-being too. So things like having an income that affords some kind of livable quality of life, being able to get good quality food, water, sanitation, warm and dry housing, safety, and employment. And addressing things like the precariousness of modern life, where things like housing and employment can't be counted upon, where they may end or change quickly without much ability to accumulate resources like money or savings to get you through lean times. When we talk about disasters or a crisis, we often focus on the disruption and stress caused by the event. In the case of COVID-19, it's the health impact of the virus on people and communities. But secondary stresses are circumstances, events, or policies that are indirectly related to or a consequence of the emergency event, which then results in strain for those people who are affected by it and makes it more difficult for them to return to what's seen as normality. So examples of secondary stresses are things like ongoing financial strain, relationship strain, job insecurity, and or job losses. It's really, really important to view these through the lens of problems of living. For many people, it's not mental distress that they will experience directly. It's much more likely that they're going to be worried about paying bills, rent, mortgages, or other outstanding debt, having enough food to eat, clothes to wear, money for transport, power, heating, the basics. And what worries them and causes anxiety is this. So in this case, it doesn't make sense to treat the anxiety. It makes far more sense to address the problems that are causing the anxiety and worry. So addressing housing, safety, food, water, income support, employment, and support to those people who provide employment, and income generating opportunities for others. All this needs to run alongside ramping up services to help those who need support in dealing with the anxiety and concerns they feel. If we focus our support on dealing with problems of living, then we've got a good chance of helping people with their very real concerns about how they will deal with their living circumstances, as well as dealing with the very real discomfort and worry they are experiencing right now. Hey, thanks for watching. You might also find this video helpful. Please share and subscribe to this channel for more like this, and hit the notification bell so you make sure you know when my next video comes out. Thanks for watching, and go well.